Lena and me. We've learned so much from everyone we've spoken to, the students, faculty. It really has been a wonderful conference, so thank you very much. As my wonderful introducer noted, I'm Meredith Rosenthal. I'm a professor of health economics and policy at Harvard University's School of Public Health. I'm a middle-aged American woman, a few inches taller than Dr. Alina, and much shorter than not Dr. Caroline. um, and so as a public health person, I have to say I love the topic of this conversation, which I think has become as we would say in the US, a fireside chat. So picture the fire. We are having a fireside chat, and we hope that you all will join us in this conversation.
Sure.
The World Health Organization defines health as a state of physical, mental, and social well-being. This definition obviously goes well beyond the absence of disease. And so it's obvious to me that the work we're talking about here, empowering people with visual impairments, the work that Kadam does is public health. There is no question. So much of the conversation that we'll have today is how do we operationalize that? How is the health sector actively engaged in the work of impairing children and adults with visual impairment? And so I wanted to start by just asking for the way you think about the intersection between public health and the work that you're doing here.
Sure. I'll start this by mentioning two things. One is that we provide the health service to all 500 students who are in our Arnodaya program. To the extent that any and every possible challenge they might incur, we help them out. We pay for it, we find doctors, we find nurses. The only thing we do not do is administer medicine ourselves. And there are regulatory implications for that. The second aspect there is that, as we know, education is a major determinant of public health. Through education, we believe that our student population in the Arnodaya program takes this message of good health and hygiene to their families, to their siblings, and others. And I think that's kind of an indirect approach that we are taking. And the final part here is that because education is a known determinant of public health, it is particularly true for this population that the governments of the world should actually push for. Because through education comes the financial independence for the family, and through financial independence generally comes better health. So, yeah.
Yes, I think that's exactly as I see the WHO definition and the way we think about the production of health. I'm an economist by training, and it's very clear, I think, in practice that economic well-being, social well-being, the opportunity to connect with people in your community, all of those things improve health and also improve economic performance, both within the household and in the market.
Sure.
I think that makes a lot of sense. I don't know the Indian health system very well. I've tried to read as much as I can, but your country, like ours, is big and diverse and has many layers of healthcare policy. So I wonder if you could say a little bit about what are the barriers for visually impaired individuals in accessing healthcare and in attaining the best possible health, as Caroline defined it earlier, thinking about nutritional well-being as well.
Sure. So we have in India, we have Health for All, under an insurance system that covers, I think that covers all people all underprivileged people, sorry. I knew the name of the thing, I just forgot. It's Ayushman Bharat, yeah. In fact, Ayushman Bharat CEO gave a talk at Harvard just a couple of years ago, very young, dynamic person. And so that's something that covers it. But a lot of people do not know about it still, even though it has been there for almost 4 years now. So the one major challenge in India is the communication does not reach to all. And the second part is that unfortunately, many of our brothers and sisters become blind because they don't get the treatment they needed at a certain time when they have an accident. And the reason they don't get it is just the ignorance, because for majority of them, parents are not educated. Parents did not go to school, so they sometimes do not see the value of taking a child to a doctor. Otherwise, the primary health care in India is free of cost, and it's available all over the country. And the quality varies depending on which state you go to or which areas you are in. So, excuse me. So those are two main ones, and I think the real private health insurance that has a wider coverage, that health insurance is not available to most of these people just because they're not working. I mean, it's related to work. The employer provides that kind of insurance. So, and then some states have their own insurance. They do not participate in Ayushman Bharat. So there is a challenge there as well, because some states can do a better job than others. So in terms of, again, implementation is always a major issue. Some states do it better than others. Sometimes the states that pick up Ayushman Bharat, do a really good job.
And I think you've been alluding to in a couple of your answers this question of health literacy,
Yes.
Which really envelops both access to healthcare and health insurance, but also issues like supplementation that we talked about before. How important do you think actually teaching families, children about how to improve their health? What is important about maintaining and promoting health? How big a role do you see that playing in
That
this
can
work?
actually play a huge role. I mean, I think just to share with you that when I was growing up, we used to get these vitamin A, the fish capsules, and they really stink. They really don't taste very good. And so if I got 50 of them, I'll probably at the most use one and throw away 49. I must also say that until after my PhD, I did not know how to take a tablet from mouth. I simply did not know that. I mean, it's basically, I did not know. I mean, I was quite outgoing. I had pen pals all over the world, over 100 of them. That's the only way I learned about the world, because there was no television in many parts of the country. But I just did not know how to take medicine. So the doctors always had to do injection to me, because I had no problem in injection. So with that being the case, I would say that, and I came from how India defines a middle class, which would be probably how the world defines as a working class. So just keeping that in mind, that I was in an educated family, but I still just did not know how to actually take a medicine, and as simple as that, a tablet. So I think any knowledge that we can pass on through some of the initiatives that are already out there, Bill and Melinda Gates Foundation and others are playing key role. There are similar organizations in India as well. So I think with those kind of possibilities, we can not just to spread the word around, but actually share this knowledge with each and every citizen of the country, particularly in the rural areas where it can make a big difference. One more thing I noticed as I was traveling in Uttar Pradesh, which is a northern side province in India, I noticed that in many villages, slightly larger villages than others, there was like a one shop. In that shop, they had, all these electronic means to register for the government schemes. Now, that was very impressive because that is very expensive stuff to do. And to do it in the entire country, it's a big country. And we don't have that in the United States and many other countries. But the question is how many people are using. And actually, I found out that quite a few people were using, but the poorest poor even didn't know about it. So I think how can we make them learn about it? And finally, I would say that one of the things that you need to use these facilities is Aadhaar card. And many of our children with blindness do not have Aadhaar cards. When they don't have Aadhaar cards, they don't have a disability cards. When they don't have disability cards, they don't get the money that government is committed to give to each and every child's parents. And this goes by, X amount of money per child in the family. So it's not like a lump sum. And so that money is different in different states because it's controlled by state and federal government, central government, both. So some states may have it 1,500 rupees per month. There are states that have 5,000 rupees per month because at election time they promised it and they had to deliver. The example is Andhra Pradesh. And we do work in Andhra Pradesh state, which is on the south side of the country. So it's a long answer to your question, but that's the current status.
Yeah, very, very interesting. And it just where you started, where the information flow 30 years ago is when you were a child. When the information flow in an earlier generation was very limited. And I would say now information is at people's fingertips. One of the challenges is misinformation around public health. That is an enormous challenge everywhere, I imagine here as well. Per your latter comment, I wonder, do you think advocacy organizations and foundations like yours can help push implementation? We're going back to the panel on inclusive education. It seems like the policies are there, but not everybody knows about it, knows how to take the steps necessary to benefit from those policies. Are local politicians the ones who can make sure that their constituents benefit, or does this really require a grassroots operation?
I think it will require two things. One is organizations such as National Association for Blind, and then there's a foundation of blind people or something. There are 3 or 4 foundations and organizations. They're doing a great job, actually, and they can expand the work. Now, here is a little challenge outside of that with the politicians. And I don't live here, so my knowledge of politicians might be quite old. But I do keep in touch in terms of reading news twice a day. The numbers are so small. The number of, and which is good news, the number of people with blindness or the handicaps is so small, they don't really form a major vote bank. So when you don't have, a major vote bank, then the politicians' interests kind of are a little bit limited. So just another example. So I was talking to people at World Bank, and I was saying, you're doing a great job on disability, and here is the challenge. We have 1.4 million, children with blindness in the world, and if they don't go for education, because education is the cheapest mean for success. In most countries, it's actually free of cost. So if you don't go for education, you are out of the world, because there's a very there's a likelihood that one would end up becoming a beggar or not be able to support themselves or their families.
So in the US, when we talk about child welfare, child well-being, there's been a very elusive goal for decades to enable coordination across the state departments of education and health in particular. And I hate to bring this up here because I don't hear you talking about it in India, but for us, the Department of Criminal Justice as well, and trying to get all of those state departments to work together, ideally to integrate their funds and their activities to support what children need for their well-being. There have been many proposals, many efforts, none of them have worked for us. And I wonder, and I know you're here quite a bit, but you also are primarily in the US, if you know of any innovative approaches here in India to try to actually get decision makers in the Ministry of Health and the Ministry of Education and at the federal and state level to work together to support the empowerment of children with disabilities.
Sure. So at the Commissioner of Disabilities from Karnataka shared yesterday that he's very actively working from district to district, covering the entire state, going personally to look into what the challenges are and finding creative solutions. What he's also trying to do is to actually, so the way the funding for this area is done in India is that this area, as far as I know, does not have its direct funding to use. They have to rely on funding from all other areas. So I think what Karnataka is trying to do is to request all other disciplines to give out a certain percentage of their budget to the disability area.
Transportation, health, education.
Yes. All of them to give out a certain percentage. And I think that's going to really make a big difference. And we will see those results in next 2 to 4 years. And then I think the Karnataka could be a leading state that can test it out and then share the knowledge with the rest of the country. That's the only one that I know, unless audience.
We'd love to hear from you if you're aware of this kind of collaboration at the government level.
In UP also they have committed 5%.
So they're also collecting funds across the other functional areas to support programs for people with disabilities?
Oh, that's really great. Thank you for sharing, Professor Mittal. I think if UP is committed and Karnataka is listening and is probably going to be committed, and actually 5% is the one that's being talked about here, that can be a fantastic news for all of us because there would be a need for us to deliver. There would be a need there would be employment creation, and there would also be ability for people to have that knowledge of what the government can help with.
Yesterday, we heard a wonderful panel talking about the importance of teacher competencies and teacher training for making a reality this idea of inclusive education. And likewise, when we think about the healthcare system, the preparedness of doctors and nurses and other health professionals to care for people with disabilities, people with visual impairment, is really critical for their appropriate health care. In the United States, this is a major challenge.
Sure.
We have a colleague at Harvard, at the Massachusetts General Hospital, who studies this question, and she finds that people with disabilities often do not get the care they need. They're much less likely to get preventive care, like cancer screenings,
Sure.
Or reproductive health care based on unfounded assumptions by the physicians about what people actually want and need. And in a recent survey, she found that about half of physicians say they're not comfortable treating people with disabilities. They're not prepared to treat people with disabilities. And so I wonder if we have people in the room who have thought about engaging on that side. do physicians and nurses and other workers in the healthcare system, are they prepared to treat people with visual impairment effectively, to communicate effectively, to raise the levels of health literacy, all of those jobs that Alina talked about earlier that physicians do in their interactions with patients?
So at a very small scale, we were thinking about, and eventually were not able to do it. We were thinking about engaging physicians or dentists in that role, and we had colleagues who were physicians and dentists. But after a few years, they left us, so we kind of came back to now where we don't have a physician or dentist colleague out of the 235 colleagues that we have at Kadam or. But that's a really important question. What we were going to do was to simply provide sanitary pads to ladies who were at that age in our program. We were going to do that for high school leadership program as well as active learning program. And I'm really not as familiar with some of these health-related challenges that the girls and the ladies have, the ones with the challenge of not being able to see. But I think that's a really, really important question and is worthy of looking into and working on.
We'd love to hear any comments from people in the audience about the ability to access the healthcare system effectively and equitably. And I think we need a microphone down in the front row.
So Bianca and one more person.
Yeah, thank you, Dr. Satish. Extending on what you said, the major challenge in Indian society is taboo. We do not talk about sex education. We do not talk about healthcare from that perspective, and especially in the rural areas. This brings in such a big divide between what is there and what are people supposed to know. A good example is we work with many special schools. And in these schools, there are girl students who have absolutely no idea about hygiene. The reason is nobody taught them that. Even coming into the special school, the teachers were hesitant to even talk about it. So unless we break down these taboos, unless we are open about natural phenomena, unless we talk about it in a very clear, concise manner with the student or with the child appropriately to his age, it's not going to be sufficient just by encouraging doctors to be a part of this. Doctors do play their role, but unless the child reaches the doctor, it's the family, is the teacher who need to break down this barrier and accept that this is a part of your life and we have to talk about it. Sighted children will look at things, learn from people by emulating them. Blind child needs to be taught experientially. And unless we have that courage to openly discuss these issues, it becomes a major area of concern. Thank you.
Thank you.
Any other? Bianca has a question.
Bianca had a hand up.
Dipesh.
Thank you. Dr. Rosenthal, you made this comment briefly about misinformation and disinformation, and I'd love to learn a little bit about both the Indian as well as the American context for how social media and maybe even mainstream media is complicating the work that governments as well as grassroots organizations such as the Kadam or Foundation, they are doing in the area of public health. And this possibly also relates to the comment that Dr. Mobadi just made. Any thoughts on that? And as an extension of that, is there a way for allies such as myself, people who have a foothold in the private space, in the corporate space, who can help in this area, right? Because this is massive and pervasive.
Yes, it's an enormous issue in the US for sure, and I know that there are people working on trying to find solutions. One complicating factor is that we think about finding ways to communicate to people who are the trusted sources of information, but trust itself is absent in so many spaces in the US. We are so polarized that there is no trust in, for example, our public health agencies. They're at an all-time low in terms of trust, so that if you want to get reliable evidence to the public, it needs somehow to be filtered through a champion that is trusted by the people you're trying to influence. Our young people learn about public health issues on TikTok. They do not go to the Centers for Disease Control. And I think this, I'm sure Dr. Alina would have more to say about this, but I think it has a big impact in clinic. People come to the clinic with their own set of information and misinformation, and a part of the conversation that physicians have with their patients now is trying to educate them both on the content but also on how to navigate the information. And perhaps this is similar here.
I think so. Maybe Dr. Alina can say a few words on it. Thank you.
Hi, thanks for tossing the microphone to me. I probably, going back to this trade-off idea, I feel like social media has a positive side to it, and it really depends on what someone's watching. I feel like for the disability space, I have learned so much more from Instagram recently than I could ever learn as a physician. And if Kadam also wanted to have a social media presence, I feel like it could be part of the ecology of learning, just breaking down the barriers, because most people don't necessarily meet a person with disabilities unless their job, like mine, makes it very prevalent, or they're born into a family that has someone, so they can learn that, hey, it's all going to be good. You just have to work at it a little bit more. So I think there's a positive side, but you have to make your algorithm a virtuous loop instead of a negative one. Yeah.
Perhaps there is a comment that Pranav, you might want to make, because you spend a lot of time on social media creating content that people enjoy watching. Do you have a, sorry for throwing the
No, I think it's, thank you. This came out of left field, but I will try to do my best. I think it's just all about perfect information. We talk about it a lot in economics. Dr. Rosenthal, as you would know, social media can be a very important reason for something like information failure. But it is very powerful, and as Dr. Alina said, I am a big proponent of it as well. The only thing that we need to understand is the concept and the practice of cross-referencing, and that goes for both the people creating the content and the ones consuming it, because we are very prone to confirmation bias, and that can lead to information failure, imperfect information, and externalities. And for those not studying economics, bad juju. Thanks.
Well said, Pranav. Just coming back to this idea, when I was thinking about this panel, again, to me, everything that you do is public health. But then there's this operational side about, how best to engage and upskill the healthcare system, but also to engage other areas of finance. And I wonder if you think there are any risks to trying to broaden your base in some sense to involve the health ministry, for example, because I can imagine a scenario. There's a hospital of an ALI fellow in Chicago, you may know, Rush, that has basically a CSR initiative. And when they started it, they used their CSR funds to have immunization programs, to go out into the community to immunize people. They never asked the community what it wanted to improve its health. And you won't be surprised that when they did, the community said, we would like jobs. Which, again, jobs are critical to public health. And so sometimes the healthcare sector can get so focused on the inputs that it controls, medicine, doctors, nurses, it forgets that the outcome that it is concerned with is not solely controlled by those things. Do you have any concerns about collaborating with people who may be very focused on inputs and not on the outcomes, the outcome of empowerment, the outcome of well-being?
Well, I think not as much concern, but I would say that it's an opportunity to work with all. But you are right that the employment is really the number one area that comes from people. So when we talk to parents, and the parents decide to move from one location to another, we always tell them that if you are moving, please let us know so that we move with you. So we will have a mentor hired in the place where you're heading, because you don't have a job in the current place, and so you got to move to Delhi or a large city. But we want to move with you. We'll arrange a mentor and a special educator for your child. The other interesting questions that come, which are not coming from too many people, but they do come, is, well, you're giving our child education, so that's good. Can you give us a home? Can you buy a home? And I think it's hard it's a hard question to answer. And I wish I had enough money to give a home. I think the Prime Minister of India's fund is doing millions of free homes to people and the families. We don't have funding to actually construct homes for people. But one of our students, his home got burnt just maybe 10 days ago. And we are constructing home for them. But we cannot do it for everybody. So yeah.
Well, I think we are the last thing between you and lunch, and I can hear my stomach growling. So I just want to say that I have learned so much, and I've taken away a couple of really important lessons from all of you. First, about how important it is to organize these efforts around the voices, the talents, the needs of the community that you are supporting. And also, we want to jump in? Yes. Please go ahead.
Yeah, I would say suggestion or question like that. First of all, in health sector, we doesn't have structured data, and also documentation is the problem, and good information from the responsible authorities. It could be any authority. I don't take specific names, but they should create the information directory that people can access accessibly, not just taking a picture and uploading in the website. That most of the website I have seen in most of the world health sector. So that should stop. They should create accessible resources. Next, they should be bureaucratic should be stopped. It should be as soon as possible when someone require any help in a medical situation. The medical bureaucracy is too much in most of the government sector. When someone needs any medicine, they need a medicine. They don't need any unnecessary suggestions and dialogue. So I remember always one thing: if you someone is not having food, if I teach philosophy or any kind of medical dialogues, it not fulfill his hunger. What I need to do is what he need, I need to give. I don't need to preach what I want to preach. I hope that medical industry learns. Thank you.
Thank you. Well, I think that takes me very much to my second point, which is I think you have all talked about the importance of really meeting people where they are and thinking very holistically about the outcomes. This is not education for education's sake, but education for empowerment, and that is really critical. And I am just so incredibly impressed by the momentum and the trajectory you're on, and I look forward to seeing what you will do in the next decade. Thank you
Thank
again
you very
for
much.
everything.
Thank you, Meredith.